A deadly virus is spreading across the US, quietly moving from farms to humans, and most people have no idea how serious it could become. It started in birds, then made an unexpected leap to dairy cattle. Now, human infections are being reported, with 66 confirmed cases and the first fatality recorded in Louisiana. Health officials are tracking it closely, watching for the one thing that could change everything: the mutation that allows it to spread from person to person. If that happens, we could be facing a global crisis. The CDC says the public risk is low for now, but scientists aren't taking their eyes off it. Neither should we. It began as a problem for farmers. They noticed dairy cows struggling to breathe, producing less milk, and, in some cases, dying suddenly. At first, no one suspected bird flu. It wasn't supposed to infect cattle, but tests confirmed the worst. H5N1 had jumped species. That alone was alarming. But when people who had contact with infected animals started getting sick, the situation became much more concerning. Right now, the virus isn't spreading between humans, but the real fear is what happens if it does. Viruses mutate all the time. If H5N1 evolves to transmit from person to person, it could spread rapidly, just like past pandemics. A CDC official recently stated, "The current public health risk remains low, but we are monitoring for any changes in transmission." The problem is, by the time that risk changes, it may already be too late to stop it. Even if you're nowhere near a farm, this outbreak is already affecting your daily life. Egg prices have skyrocketed to $10 per dozen, poultry farmers are culling millions of birds, and dairy shortages could be next. The economic impact is spreading as fast as the virus, and experts are debating whether mass vaccination of livestock is the only way to stop it. For now, precautions remain simple: avoid contact with wild birds, wash hands after handling poultry, and cook eggs and meat to 165 degrees Fahrenheit 74 degrees Celsius. But scientists are watching closely for signs that the virus is changing, and if it does, everything could escalate quickly. No one knows how this will play out. Will it fade away like past outbreaks, or are we seeing the early signs of a much bigger crisis? Let's talk about it. Are you worried about the bird flu outbreak? Should we be preparing for something bigger? Drop your thoughts in the comments, hit like, subscribe, and stay updated.